Harsh Mahajan and Varun for having me here. And thank you to the audience for putting up with the post-lunch session. So Avinash, I think this is the fourth session on technology since morning, technology in healthcare. And couple more sessions, I would have declared that we'll soon have a AI hospital. Yes. So I think that much of technology we have been ingrained with. But I think the key takeaway for me as an operator is that we are not talking about AI hospital. We are talking about human hospital powered by artificial intelligence or technology to say. And that's the essence of healthcare. That's why we all exist. We exist to serve the humanity at large. And technology today is the biggest enabler for everything that we have heard in last 2 days as a challenge and as an opportunity both, whether it's about accessibility, driving affordability, driving early detection, prevention. One of our friends here was telling me, any conference we go, we hear just 3-4 things: accessibility, affordability, prevention, and then we go back to our boardrooms and we hear some other matrices. Yeah, profitability, EBITDA, ROI, and ROCE. And that's so true. But I think the one way to balance both is technology. It's in a way to say, if you deploy technology in the right way, it will just take away the frictions and so much of administrative bandwidth that is taken away from a caregiver. And then caregiver could sit by the side of a patient and do what is human. So I think that's the role of technology. If we envisage the role of technology like that in healthcare system, I don't think we are saying technology as an impediment to human hospital, but it's an enabler for a more human hospital. I think what is not human is to delay a diagnosis, not reach a speedy diagnosis in time and hence delay a treatment, and hence lead to a poor outcome and poor quality of life. Today, technology can enable all that. We could reach a blood culture report in hours. We could start definitive antibiotic treatment within few hours of ICU admission. We could get a patient out of ICU within a couple of days. I think all this is possible and leading to a better quality of life post-discharge, which we as providers, we never envisage. We do not monitor. We do not count about. I think that is human, to care for that life beyond hospital. And hence we need the technology to reach that. We talk a lot about accessibility and affordability. There is so much of care divide that exists in this country today. There is this India and there is that other India. And I hear, people like Dr. Suchin Bajaj serving the other India, reaching in tier 3 cities, tier 4 cities of this country, using technology as an enabler to provide access to millions who would not have been served otherwise. I think that is about building a human hospital, a human healthcare. So I think technology is only enabling us in providing more human care, in building more hospitals which are more. It's nowhere an impediment. And like I said, it's not a digital or AI hospital. It's a human hospital enabled by digital tech or artificial intelligence. However, the matter of ethics will always prevail in tech adoption, like Vipul mentioned. CRISPR as a technology, when it came, I think it was a thought that will create some Frankenstein's monster again. But what CRISPR did to humanity at large, we all saw during the time of pandemic. I think, again, going back to the first session, the session of legends, the soul has to prevail over mind and our actions, and it has to guide our actions. So technology adoption, yes, but I think soul taking precedence over mind, and hence leading to building human healthcare and human hospital.
Anything you would like to add on the role of different types of partnerships that will exist in the future?
So a future hospital cannot exist in silo or isolation as a hospital in its own right. I think future hospital will exist in a network or an ecosystem. Now that ecosystem cannot be built by a hospital provider alone. It has to be built by multiple partnerships. That partnership has to evolve with hospitals amongst each other. That partnership has to evolve with hospitals and technology partners. That partnership has to evolve with the government and the private providers. I think the amount of access that government could drive and the agility that private providers could bring in, both are critical to seeing a hospital ecosystem of future. Similarly, technology in isolation without having access to the kind of data that government is enabling. We hear 74 crores healthcare patients' data has been routed through ABDM. Now that's a huge data. The world cannot envisage. I think that partnership, collaboration of that ability to use that data provided by government, by our medtech and health tech players, could do wonders. I think it's difficult to envisage what all it could bring out. Even today, we do not have a single AI-driven platform which is developed for India, in India, by consuming data of India. I think we're still looking forward to it. A government-private partnership is a key enabler. Similarly, the partnership amongst hospitals is crucial. I always say that we are not competing amongst each other. If at all anything, we need to collaborate more and more. Because I think we need to create another 10 lakh beds, as we heard today morning. And there is a lot more that each one of us could bring together. So to sum up, I would say technology is making healthcare smarter, but only empathy will keep it human. Thank you.